Hello, my name's David Nelson. I'm the National Clinical Strategy Manager for Convatec's surgical team. Within our surgical team, we have orthopedic, general, tissue viability, and midwifery experience. I'm going to focus in today on our negative pressure wound therapy 30-day pump called Avelle and its interactive dressing that has hydrofiber as a contact layer. I'm going to take you through a step-by-step guide on how to apply Avelle on Caesarean section incisions. This is what the Avelle products look like when packaged. The Avelle pump and dressings come separately. The dressings come in boxes of 5. This is to give healthcare professionals the flexibility to select the dressings when they need them, as the pump lasts for up to 30 days. The dressings can stay in place for up to 7 days. The tubing in the packaging is to increase the distance of the pump to the dressing, so it can be placed in a position that is comfortable for the patient. A continuous negative pressure of 80 millimeters of mercury is maintained at the incision or wound surface when the pump is switched on. Any exudate is managed by the dressing through absorption and gelling capabilities of hydrofiber technology and via moisture evaporation at the dressing interface. Patient selection is very important and should always be done by healthcare professionals. And the clinical team I mentioned earlier can help healthcare professionals, if needed, make that decision along with our evidence and pathways. This is part of the value-added service we offer to help clinicians make an informed decision and make sure all contraindications and precautions are followed. Please make sure the peri-wound skin is dry and clean prior to application. We suggest using an aseptic technique to apply the dressing. When selecting the correct dressing for application, make sure the incision fits with the hydrofiber pad with at least 1 centimeter of the pad onto the peri-wound skin. We suggest prophylactic use of Avelle, but if you have an incision that is dehisced, then it can be used on wounds up to 2 centimeters of depth. We suggest using Aquacel Extra or Aquacel dressings to pack any wounds that are over 0.5 centimeters. Remove the release liner and apply the dressing centrally flat to the incision and gently smooth the dressing down, trying to avoid any creases. I have removed one section of the release liner, starting with the centerpiece. It is also possible to remove all the liners at the same time and then apply the dressing. Remove the second release liner and continue to smooth down the dressing. The silicone contact layer on Avelle has been designed to be gentle on removal. If there are any creases, lift and smooth out where possible. Remove the third release liner and smooth down the dressing. Avelle dressings come in multiple sizes. In this video, I have used the 12 by 31 centimeter dressing. Check the entire dressing area again to make sure there are no creases, as this can cause air leaks. Six fixation strips come with the dressing, and they are all the same size. The strips have release liners. Follow the 1, 2, and 3 numbers to apply the dressing correctly. Apply the fixation strips with about 1 centimeter overlap onto the sides of the Avelle dressing. The strips can also be cut especially for the smaller sides of the dressing, or if you prefer to work with smaller strips, which I have shown here. Insert the batteries into the pump by removing the compartment cover and inserting 3 out of the 6 AAA batteries that come with the pump. The pump comes with 6 batteries so that it can last the duration of the 30-day pump life. To switch on Avelle, press the blue button on the front of the pump for 3 seconds. The green indicator light will flash to establish negative pressure. At this point, you will hear the pump working. If the negative pressure is not achieved, the amber indicator next to the green indicator will start to flash. At this point, smooth around the dressing, making sure there is no leaks, and apply more fixation strips if needed until the green light starts to flash. If you need to turn off the pump, simply hold the blue button again. Convatec hydrocolloid sealing strips are indicated for use on intact skin as a replacement device to help promote an airtight seal for patients receiving negative pressure wound therapy. The sealing strips can be used to help seal leaks around the periphery of the negative pressure dressing. Convatec hydrocolloid strips can also be used as a replacement for the fixation strips in the areas of the Caesarean section that have a high possibility of leaks. Hydrocolloid strips can be placed on intact skin areas surrounding Caesarean section incisions that have a high risk of leaking. The Avelle dressing borders can be placed on the hydrocolloid dressing, creating a strong seal. Thank you for watching this video and keep up to date with everything happening with Convatec on all our major social media platforms.